Right. So now it gives me great pleasure to introduce Peter Noble, Vice President of University of New South Wales. Peter joined us recently as Vice President, and he has a wealth of senior leadership experience in both health and education. In the UK, where he was Chief Executive of a UK Academy School, he was COO of a large London hospital and of the UK Medical Research Council in the Gambia, and more recently he was the Chief Operating Officer of the Manchester Academic Health Science Centre. He's led the international review of 27 academic health centres across 4 continents, and at UNSW, I think one of his many special areas will be overseeing the global impact strategy of the university. So with that, I ask Peter to come up and address us.
Thank you, Peter, and good morning. This is a very special morning and a very inspiring video, really. A remarkable man, and it's amazing for the first time that we are the university nationally setting up this social business health hub. A way introduction, my understanding in terms of the evolution of this is that Professor Yunus, the Nobel laureate from Bangladesh, and hadn't fully appreciated the Bangladesh, the size of the community in Australia until I spoke to Rihanna, growing increasingly, 100,000, a colleague has just shared with me. So the social business is about solving global problems, global social problems in health, in education, and in poverty, and transforming poor and marginalised communities through research into social business. Now, my understanding, a memorandum was agreed. In fact, there's a picture of one of our Deputy Vice-Chancellors, Les Field, there in the corner. And this, Rihanna, this was set up last October, and it's from the Yunus Social Business Centre and the School of Public Health here in the University of New South Wales. Now, under this memorandum, the understanding is public health, community medicine will collaborate with the Yunus Centre established by the Nobel laureate in that very inspiring speech. So this is really about improving health outcomes in Australia, Asia and Pacific. And the only reflection I have when I made the decision to come here probably 6 months ago, I was interested in looking at some key policy documents that were emerging through Australia. And there was an interesting article from the Australian Council of Social Services. And there was a staggering figure in that, which is 2.5 million of this population, this national population, that's 14%, are living below the poverty line. So I think it really highlights the linkages here, both the strengths within the university and the remarkable leadership of medicine through Professor Peter Smith and also Rihanna in terms of making this happen. And this is a real cause for celebration. So the Social Business Centre in Bangladesh serves as a global hub, and my understanding is that there are now about 20 of these hubs internationally, in America, in Asia and in Europe. The UNSW Social Hub is located in the School of Public Health and Community Medicine, and it will have a very strong focus on e-health. E-health was a notion very new to me many months ago, and speaking to a colleague at the front, it's been a real quite revolution here at UNSW in terms of the work it's done in disaster management. And it's hard to comprehend how e-health is going to change our lives. The fact now that we can get modern apps applications to look at our lifestyle, to monitor our health and well-being. So this is clearly an area of progressive development over the next few years. I would also like to welcome P.S. Chennai, General Secretary of the Bangladesh Awami League. We are pleased to engage with the Bangladeshi community in Australia to raise awareness of the support for this hub. And we also, that business leaders and others in the community here today will become much more involved in this centre. We also like to welcome Dr. Faz Shah, head of the Yunus Centre in Thailand, who is here today. So the centre and UNSW aligns very strongly. We're on the infancy of developing a strategy, a 10-year plan. Our priorities are threefold. One is academic excellence, second is around global impact, and the third is social engagement. Global impact and social engagement very much flows from academic excellence, and this fits nicely in terms of this initiative hitting all those areas. I'd like to focus on a couple of specifics really. The first is really in terms of the role of UNSW in terms of international education. Now the business health hub in other countries offers PhDs, masters, undergraduate short courses on social business. Programs in Glasgow, Caledonian University, California State University. So in terms of UNSW, we could offer learning on social business, whether we use it through MOOCs to outreach international students. And by connecting networks, we're attracting new markets, focusing on global students, leaders and professionals. But it's not just about education, it's also our contribution to the developing world. The centre will work for social development, for economic and otherwise by connecting and communicating across physical, across social, across cultural boundaries in disadvantageous communities in the world. And by connecting this network, we'll be able to contribute to global poverty and inequalities. One of the prevalent issues that comes to the fore is that the economic impact on health and well-being doesn't always get recognised. Whether it's in the health system or whether it's in a university, every dollar invested generally produces a 2 or 3-fold. So we have to invest in education and research and also our services to receive that benefit. So finally, I would like to welcome our guests, and we would now like to move over and pleased to inaugurate the Yunus Social Business Health Hub here at UNSW.